Hello, everyone. Welcome to session 2 in your workbook. Today, we're going to talk about hypertension. For today's session, you will need your workbook, your My Blood Pressure wallet card, and then also your blood pressure monitor. As you can tell, I split this session into 2 parts. The first session, we will be going over what's in your workbook. The second part, I will be showing you how to use your blood pressure monitor. If you already know how to use your blood pressure monitor, please feel free to skip part 2. So let's get started. So typically we would begin each session going over our action plan from the last session. So during this session, we would be talking about our action plan for session 1. Since we aren't meeting in person, so like I said in the session 1, this workshop has always been an in-person workshop. So we would go around the table and kind of give a brief update on how we were doing with our action plan. Since we were unable to do that, I will just assume everyone is doing fabulous. If you do have any questions or need help as far as your action plan goes, please feel free to reach out to me. I am available. All right, so if you turn to page 2 in your workbooks, it's titled Hypertension. These are the questions we'll be answering today. So what is high blood pressure? What causes high blood pressure? How is hypertension related to other diseases? What are the different types of high blood pressure? How is blood pressure measured? Why should you monitor your blood pressure on a regular basis? And then how can you treat and control high blood pressure? So what is blood pressure? First, let's talk about the basics of blood pressure. If you turn to page 3 in your workbooks, here you will see a picture of how your blood moves through your blood vessels. Blood pressure is the force of blood against artery walls as it is pumped through the body. And if you turn to page 4 in your workbooks, you can kind of fill in the blanks while I keep reading, while I keep continuing on. Our heart beats about 60 to 70 times a minute at rest. Each time the heart beats, it pumps out blood into the arteries. Blood pressure is highest when the heart is pumping out of the blood. This is called systolic pressure. When the heart is at rest, blood pressure falls. This number is called diastolic pressure. Now that we know some of the basics of blood pressure, let's move on to discuss high blood pressure. High blood pressure means that the heart has to pump harder than normal for blood to get to all parts of the body. Blood pressure is blood pressure is too strong or too high when the heart works too hard or the arteries are too narrow. A heart that has to work harder than normal for a long time gets larger and weaker. Then it has an even harder time doing a good enough job pumping blood. High blood pressure is also called hypertension. You may see the term abbreviated as HTN or HBP. High blood pressure increases a person's risk of heart-related problems, including heart attack and stroke, because of the strain of the heart and the arteries. All right, so if you turn to page 5 in your workbooks, it should be titled, Why is High Blood Pressure Harmful? And then just fill in the blanks as I continue. High blood pressure can cause the heart to get larger, which may lead to heart failure. It can also cause small bulges called aneurysms to form in blood vessels. Usually these occur in the aorta, the brain, legs, intestines, and the artery leading to the spleen. So why is blood pressure harmful? Blood vessels can also become narrow in the kidney, which may lead to kidney failure. When we say hardening of the arteries, we are talking about these same areas, especially the heart, the brain, kidneys, and legs. This can cause a heart attack, stroke, kidney failure, or lead to amputation of part of the leg. Blindness can also occur when blood vessels in the eyes are affected. High blood pressure causes the heart to work harder than it normally would. High blood pressure increases the risk of heart attacks, strokes, kidney damage, eye damage, heart failure, and aneurysms. If high blood pressure isn't treated, the heart may have to work harder than it should to pump enough blood and oxygen to the body's organs and tissues. A heart that is forced to work harder than normal for a long time tends to get larger and weaker. A slightly enlarged heart may work just fine, but one that's greatly enlarged has a hard time doing its job. And if you turn to page 6 in your workbooks, titled High Blood Pressure, and then fill in the blanks as I continue. So high blood pressure affects more than 72 million Americans. That is 1 in every 3 adults. Although high blood pressure is so common, it is not a part of healthy aging. While over half of all Americans over the age of 60 have high blood pressure, and about 3/4 of those over the age of 70 have it. There are things you can do to keep your blood pressure levels at an optimal level. The good news is that high blood pressure can be treated and controlled. Right, so a number of conditions and behaviors can lead to high blood pressure. Sometimes high blood pressure is caused by another medical condition, such as kidney disease or lung disease. Some conditions and risk factors you can control, others you cannot. So, and this is when we would kind of do a Q&A. So I would ask, is being hypertensive a normal part of aging? And anybody in the workshop would be able to answer. So I will kind of just do it with myself, I suppose. So no, over half of Americans 60 and over do have high blood pressure. Nevertheless, it is not a normal part of aging. There is much you can do to prevent high blood pressure, such as the tips we will discuss today, such as eating healthy, losing weight, and then also getting more exercise. My second question would be are there warning signs? Yes, high blood pressure is often called the silent killer because there are often no physical signs. You can go years without knowing you have it, but as we will learn today, it is easy to identify risk factors in our everyday life. These factors can warn us or serve as cues to let us know we are at risk. These include factors such as age, medications, smoking, eating, activity levels, and then drinking habits. All right, so turn to page 7 in your workbooks. And once again, this is a fill in the blank activity. So just fill it in while I continue on. Factors that contribute to high blood pressure are sodium in the diet. Most Americans take in more sodium than their bodies need, and too much sodium can increase blood pressure in some people. Your daily intake of sodium should not be more than 2,400 milligrams or about 1 teaspoon of salt. Being overweight or obese, lack of physical activity, heavy alcohol consumption, diabetes and kidney disease, race, age, gender, smoking, and family history. To summarize, a risk factor is a preventable or non-preventable part of your lifestyle that increases your chances of heart disease. Some risk factors that can be prevented to keep your heart healthy include smoking, diabetes, being overweight or inactive, stress, and drinking too much alcohol. Blood pressure is measured as a part of a regular physical exam and also during most visits with a doctor. Your blood pressure may be measured at a health fair, when you donate blood, or as part of another type of medical screenings. If your blood pressure is high, your doctor will ask additional questions. For example, your doctor will ask whether your high blood pressure runs in your family and what your eating habits are. It is especially important to be aware of how much salt in your diet and talk about your salt intake with your doctor. Let your doctor know if you add salt to your foods at the table, if you cook with salt, eat a lot of canned foods, frozen dinners, or highly salted foods such as peanuts or chips. So what are the warning signs of high blood pressure? A person can be calm and relaxed and still have high blood pressure. Many people have high blood pressure for years without knowing it. That's why it's called the silent killer. For these people, their blood pressure numbers are often their only warning. This is why it is important to check your blood pressure on a regular basis. However, high blood pressure in some people will cause one or more of the following signs, especially if it's very high for a while. So it can cause tiredness, confusion, nausea or upset stomach, vision problems, trouble seeing, nosebleeds, more than normal sweating, skin that is flushed or red, or skin that is pale or white, anxiety or nervousness, ringing or buzzing in ears, and headache and dizziness. Remember, you should check your blood pressure as often as your doctor advises. If you turn to page 8 in your workbook, it's how is blood pressure measured? So blood pressure measurement is quick and painless and doesn't require any blood to be taken. When we measure blood pressure with an instrument called a blood pressure monitor, it typically has 3 parts: the cuff, a pump attached to the cuff by a tube, and then a dial or screen that is also attached to the cuff by a tube. The cuff, which is like a wide strap, wraps snugly around your arm above the elbow. Arms of different sizes require different cuffs. Like I said in session 1, it typically isn't a one size fits all. So what monitor I have is kind of the average monitor, but I definitely have a monitor that I have a smaller cuff and then monitor that has a larger cuff. So if you think your monitor that you received isn't the correct size, please feel free to reach out to me and we will get you situated with the right cuff size. The person who measures your blood pressure squeezes the pump rapidly to fill the cuff with an air until the pressure of their cuff against your arm temporarily closes off the blood flow in the main artery of your arm. Some blood pressure monitors have an automatic pump, and that's what you guys have. So this person then places a stethoscope on the inner crease of your elbow over the artery in order to hear your heartbeat when the blood begins moving through the artery again. Some monitors have a built-in stethoscope, which once again, that's what you guys have. He or she slowly lifts the air out of the cuff, reducing pressure on the arm and allowing the blood to flow again. The blood pressure reading shows up on the pressure registering device attached to the cuff, either a screen or a number dial with a pointer. Each blood pressure reading has a pair of numbers showing the highest and lowest pressure during each heart cycle. The highest number is called the systolic pressure and the lower number is called the diastolic pressure. Blood pressure is measured in millimeters of mercury.